I've been a family physician for 30 years in a multitude of settings. So Nassim's dad called this morning, a bit concerned his son was out playing and been struck by a ball in the yard and started having nosebleed. So Mr. Mittel, why not go right ahead and tell me what actually happened? I think he was concerned about concussion or head injury. Do you see any other bruise, cut or laceration or anything on the skull or the face?
There doesn't seem to be any bruising.
So aside from crying and being a little upset, he seems to be acting normally.
Yeah, he's acting normally.
First thing was just try to elicit his concerns, and then of course to make sure the child was in a condition that it was reasonable to proceed with a telemedicine consult versus running off to the emergency room. How are you, Nassim?
Say hi.
Hi. I concluded that this was really just a simple anterior nosebleed, no significant head injury, and nothing that would require imaging or further evaluation. From what I can see, his nose is straight. I don't see any deformity of the nose or nostrils or any laceration. And I do feel, since the bleeding has stopped, you really won't need to intervene in any significant way as far as putting ice on the nose or anything of that sort. I think you'll get by really just fine just by keeping him calm and observing him for the next few hours.
Okay, great.
In an injury of this type, the examination done through telemedicine versus hands-on is essentially the same. I think if they come to the office, they would have waited quite a bit longer because they'd be a walk-in patient, and we try and allow slots for walk-ins, but that's a bit challenging in a busy day. If you have any other questions or concerns, please don't hesitate to call us back.